Hi, hello friends, good morning. Welcome to our channel, The Voice of Nurse. In today's class, we are going to discuss a continuous topic from the previous video, Model Paper for Staff Nurse 2023, Part 2. Previously, we already discussed 3 sets of model paper plus mock test from the TS MHSRB. We already discussed in detail about these 4 sets of model papers. Today's class, we are going to discuss model paper set 5, Part 2. Previous last class we already discussed related to the part 1 model paper of set 5. We already discussed 20 questions in part 1 previous class. I will give a link in description. Anybody not seen previously last class, just check it once in description. I will give a link. In today's class we are going to discuss part 2 related to this set 5 of model paper for the staff nurse 2023 exam purpose. Before moving on to topic, a small request friends. Anybody here new to this channel, please subscribe my channel, click on the bell icon for further notification, and please share the video to your friends. Anybody not now on this channel, please share the video to your friends. Each and every subject we already finished 100 MCQs, very important question. Previous year's exam papers also we already discussed. Please check it once friends. Please use it to anyone. Please give a like and share your opinion in comment section. You can ask any doubts in comment section also. Let's move on to topic. Today we are going to discuss part 2 model paper of set 5. Question number 21 to 50 we are going to discuss today's class. Question number 21. The chief aim of medical treatment in chronic glaucoma. What is the chief aim of medical treatment for the chronic glaucoma? We will see here options. First option A, controlling IOP. IOP means intraocular pressure here. Option B, dilating the pupil. Option C, prevention of infection. Option D, resting the eye. We have to know what is glaucoma and chronic glaucoma. Glaucoma is a group of eye conditions that damage the optic nerve. The optic nerve sends visual information from the eye to brain, and it is a vital for good vision. Damage to the optic nerve is often related to high pressure in the eye, but glaucoma can happen even with normal eye pressure also. The overall glaucoma treatment main purpose to maintain visual function and related quality of life at the suitable cost. Glaucoma surgery aims for the prolonged IOP reduction without any complications. So here controlling the IOP is the correct answer. The chief aim of treatment for the open angle glaucoma. The goal of treatment of open angle glaucoma is prevention of progression of optic nerve head changes and prevention of deterioration of visual field, and prolonged reduction without any complication reduce the intraocular pressure also. The first line treatment includes prostaglandins, which are highly effective at lowering eye pressure. These work by promoting better drainage from the eye. Based on the assessments, we can stage patients' glaucoma as ocular hypertension or mild or moderate and severe glaucoma. For example, the disease stages. For example, 18 mm of Hg for mild glaucoma, 15 mm of Hg for moderate glaucoma, and 12 mm of Hg for severe glaucoma. This is the IOP, normal IOP. What is normal IOP? We have to know. The normal IOP, intraocular pressure average from the 12 to 21 mm of Hg. Less than 12 is called as chronic glaucoma. Here, mm of Hg refers to millimeters of mercury, a scale for recording eye pressure. Anything that exceeds 21 mm of Hg considered as hypertensive. A problem in the drainage of fluid produced in the eye causes the increased pressure of the intraocular pressure. So here in these options, option A is the correct answer. Next we will move on to question number 22. Before sending the patient for ERCP, the nurse should assess the clients. Before sending the patient for the ERCP procedure, the nurse should assess the clients. Here ERCP means endoscopic retrograde cholangiopancreatography. Here ERCP means endoscopic retrograde cholangiopancreatography. Endoscopy is the examination of the internal body parts with an instrument is called as endoscopy. Here ERCP, before sending the patient for the ERCP, the nurse should assess the client's means. We will see first options. Option A, urine output. Option B, serum values. Option C, bilirubin levels. Option D, blood pressure. Nurse should ask client not to eat or drink anything for 6 to 8 hours before the test. It is important for the stomach to be empty to allow the endoscopist to visualize the entire area and to decreases the chance of vomiting during the procedure. For the ERCP, usually have a blood test to check how well the blood clots. Let the hospital department know the PTINR, that is called as PTINR test. And also here we have to hold the patient NBM for the 6 to 8 hours before the test, means we have to monitor the urine output. We have to monitor the first preference here, we have to monitor the urine output for the client, because we are not giving anything by mouth, nothing by mouth before the 6 to 8 hours before the procedure. That's why we have to monitor the patient urine output. This is the priority question only. ERCP is a test to help diagnose condition of the liver, bile ducts, pancreas or gallbladder. ERCP stands for endoscopic retrograde cholangiopancreatography. I already explained previously. To encourage the client in the morning medicine with a sip of water only. If the procedure is afternoon, do not eat anything after midnight before the procedure. Here in these options, option A is the correct answer. Before sending the patient for ERCP, the nurse should assess the client's urine output. Here option A is the correct answer. Next we will move on to question number 23. Cystoscopy means. What is meant by cystoscopy? We will see here options. Option A, visualization of bladder. Option B, visualization of stomach. Option C, visualization of pharynx. Option D, none of the above. What is meant by cystoscopy? Cystoscopy is an examination of the bladder and urethra. Using the cystoscopy inserted into the urethra, a cystoscope is a thin tube-like instrument with a light and a lens for viewing. It may also have a tool to remove tissue to be checked under a microscope for the signs of disease. Cystoscopies are used. A cystoscopy can be used to look for and treatment problems in the bladder or urethra. For example, it can be used to check for the causes of problems such as blood in pee and frequently history of UTI, means frequent urinary tract infections, problems peeing and long lasting pelvic pain. Cystoscopy is a procedure allows the doctor to examine the lining of the bladder and tube that carries urine out of the body, means urethra. A flexible cystoscopy usually takes about 5 minutes. They may squeeze some local anesthetic jelly into the urethra to help prevent infection and reduce discomfort. Doctor will pass the cystoscopy into the through the urethra to visualize the bladder. So here cystoscopy means visualization of the bladder. Next we will see left options also. What is mean by visualization of the stomach? Is the procedure also we will see. Visualization of the stomach, also called as esophagogastroduodenoscopy. Esophagogastroduodenoscopy (EGD) is a diagnostic endoscopic procedure used to visualize the oropharynx, esophagus, stomach and proximal duodenum. It is one of the most common procedure for the gastroenterologist. Here what is meant by visualization of the pharynx means which procedure we can visualize the pharynx. We will see visualization of the larynx and pharynx is an essential part of the complete head and neck examination. Although the location of these structure often direct visualization, simple techniques can be used to evaluate them in the clinical settings. So here cystoscopy means visualization of the bladder. So here option A is the correct answer. Next we will move on to question number 24. RH factor contains Here from the options, which one is contains RH factors? We will see here options. First, option A, antigen B, option B, antigen A, option C, antigen D, option D, none of the above. What is meant by RH factor? We will see first. RH factor is an inherited protein found on the surface of red blood cells. If the blood has the protein, you are RH positive. If blood doesn't have protein, RH is negative. So positive or negative might see after the blood type refers to the RH positive and negative blood test. Here in this question, RH factors contains means whereas most blood types are determined by red cell antigens that differ by one or two amino acids. The RH blood group contains the D antigen means antigen D, which differs from the C and E antigens by 35 amino acids. The term RH factor, RH positive and RH negative refer to the RhD antigen only. Antibodies to RH antigens can be involved in hemolytic transfusion reactions, and antibodies to the RhD and RH antigens confer significant risk of hemolytic diseases of the fetus and newborns. In these options, option C is the correct answer. RH factor contains D antigen. Next we will move on to question number 25. Which substances used as the preservation agents in 24 hours collection of urine? So here preservation agent in the 24 hours are collection of the urine sample. We will see first options. Option A, boric acid. Option B, HCl. Option C, formalin. Option D, all of the above. A 24 hours urine collection is a sample lab test that measures what's in the urine, means abnormal values or anything abnormality related to the urine. We can identify through the 24 hours urine collection sample. The test is used to check kidney function. A 24 hours urine collection is done by collecting the urine in a special container over a full 24 hours of period. The container must be kept in cool until the urine is returned to the lab. 24 hours urine analysis is a timed urine collection used in the metabolic evaluation of urinary stone disease, proteinuria evaluation and estimation of the abnormality of kidneys. The urine collection different in each and every hospital. According to the collection of urine sample is different to the each and every hospital. In our hospital, for example, we will collect 24 hours urine collection for the morning, early morning 6 a.m. to next morning 6 a.m. 24 hours we will collect urine from the client. Color code also different. We are using in our hospital white color and blue color cap. In different urine bags will be there. Here, which substances used as the preservation agent in the 24 hours of collection of urine is boric acid, HCl and formalin. All of the above is the correct answer here. The commonly used urine preservatives includes boric acid. Here HCl means hydrochloric acid and formalin, acetic acid, oxalic acid. These many preservatives we are using a agent in the 24 hours of urine collection. So here option D is the correct answer. In case by mistakenly anybody, ward boys or bedside staff by mistakenly discarded urine in the one time in the 24 hours of the collection of the urine sample, means that is not useless, means we have to stop then only. Then next we have to plan for the 24 hours of collection of urine sample, because the urine sample values will become abnormal. We will not get a correct values. That's why we have to stop if we are discarding some urine from the patient means. So here option D is the correct answer. Next we will move on to question number 26. The medicine is used for Montex test. Which medicine is used for the Montex test? We will see here options. First option A, protein derivatives. Option B, BCG. Option C, PPD. Option D, none of the above. Here in the Montex test, a standard dose of 5 tuberculin units 0.1 ml according to the CDC or TTU of Statinus Serum Institute SSI tuberculin RT23 in 0.1 ml solution. According to the National Health Service is injected intradermally intradermally means here between the layers of dermis on flexor surface of the left forearm. Which drug is used in the Montes test means tuberculin purified protein derivatives, not protein derivatives. Here option C PPD is the correct answer. Tuberculin purified protein derivatives is used in a skin test to help diagnose the tuberculosis infection in a person at increased risk of developing active disease. Test is positive if there is a bump of a certain size where the fluid was injected. This means you probably have tuberculosis germs in the body. Most people with a positive tuberculosis skin test have a latent tuberculosis infection. To be sure, the doctor will examine and give the advice for the chest x-ray for further management. The reference range of the duration is 0 to 15 millimeters at the increment of 5 mm or 10 mm and also 15 mm, and in duration size of more than 15 mm is the considered positive in normal patient. A swelling of the less than 4 mm is considered negative. Next, tuberculin skin test is one of the method to determine whether a person is infected with the Mycobacterium tuberculosis or not. The Montes test should be read between 48 and 72 hours after the administration. So here the medicine is used for the Montes test is tuberculin purified protein derivatives. So here option C PPD purified protein derivatives is the correct answer, option C. Next we will move on to question number 27. Here calamities or what is related to the calamities from the options. We will see here options. Option A railway accident, option B floods accident, option C earthquakes, option D all of the above. Calamities is a disastrous event marked by great loss and lasting distress and suffering. Calamities means related to the nature. Here, a disaster is a serious problem occurring over a period of time that causes the widespread human, material, economic or environmental loss which exceeds the ability of affected community or society to cope using its own resources. Here, calamities means nothing but disaster events means somebody is losing or losing distress and suffering with nature. Example for the calamities: a serious road accident or bad event causing damage or anything suffering. A series of calamities ruined them: floods, a failed harvest and death of someone. A key differences between calamity and disaster would be their severity. Depending upon the severity, the meaning will change. Calamity is considered to be more severe and destructive than disaster. Disaster is the most commonly used word out of these two words. Here, calamities is a serious accident or bad event causing damage or suffering. Serious accident or bad events. Here option A, B, C is the correct answer. Means calamities means here related to the railway accident, floods accident, earthquakes, disasters, serious injuries, afflictions, adversity, misery. These all things comes under the calamities. So here option D, all of the above is the correct answer. Calamities means all of the above is the correct answer. Next we will move on to question number 28. Comprehensive nursing care means. What is the meaning of comprehensive nursing care? Let's see here options. First option A psychological, option B total care about patient, option C care spiritually, option D care of the body. The definition of features pertaining to the concept of comprehensive care encourages the use and standardization of nursing care plans, improving patient follow-up, the detection of the new risk factors, complications and new health problems not related to the reasons of admission. Comprehensive nursing care means that the patient receives care that is planned and coordinated around the physical, mental and cognitive health needs. The comprehensive means all inclusive. A comprehensive nursing is an approach that encompasses the total care of the patients. Here option B is the correct answer. Comprehensive nursing care means the primary care meets all health related needs of the population except those that are too uncommon to maintain the balance. Here the comprehensive nursing care means option B, total care about the patient or client. Comprehensive nursing care is a specialized area of nursing that focuses on the management of patients with the complex health condition. Here option B is the correct answer. Next we will move on to question number 29. The main function of the hospital. What is the main function of the hospital? We will see here options. First option A, promotive, option B, research, option C, curative, option D, all of the above. Hospital is an institution that is built, staffed and equipped for the diagnosis of the disease, for the treatment, both medical and surgical treatment of sick and injured, and for their housing during this process. The modern hospital also often serves a center for investigation and for the teaching. The most well-known form of the hospital is a general hospital, which usually carries an emergency department to handle urgent health issues. Main function of hospital is to provide the population with complete health care. It also functions as the center for the training of care, patient care with nursing, dietary, diagnostic, therapy, pharmacy, promotive care and curative research. So here option D, all of the above is the correct answer. The main functions and hospital play an integral role of the healthcare system to the population. The main function of the hospital to provide medical care to the patient. Here option D, all of the above is the correct answer. Next we will move on to question number 30. Nursing diagnosis means. What is meant by nursing diagnosis? We will see here options. First option A, equal to doctor diagnosis, option B, potential health problem, option C, decided by doctor, option D, normal diagnosis. A nursing diagnosis is a clinical judgment about individual, family or community responses to actual or potential health problems or life process. The nursing diagnosis means. What is nursing diagnosis means? The nursing diagnosis can conclude the nursing diagnosis based on the symptoms, impaired swallowing, for example, nursing diagnosis, risk for impaired liver function or urinary retention, disturbed sleep pattern, decreased cardiac output. These all things comes under the nursing diagnosis. Usually nursing diagnosis we will formed by the NANDA. According to NANDA we will form a diagnosis. NANDA means North American Nursing Diagnosis Association. But here the nursing diagnosis means. What is meant by nursing diagnosis means? Here option B is the correct answer. Nursing diagnosis is a clinical judgment about individual, family or community actual or potential health problems. Here the nursing diagnosis means. Here option B, potential health problems is the correct answer here. A nursing diagnosis is a judgment made after a comprehensive assessment of the patient to determine their overall well-being. So here option B is the correct answer. Next we will move on to question number 31. What is the meaning of crisis? What is the meaning of the word crisis? Here word is there, crisis. Actually somebody will think about lysis. This is not lysis. The word name is crisis. Actually lysis means the destruction or dissolution of cells by the action of particular lysine. Sometimes it's called as breakdown of the cell or tissue. But here what is meant by crisis? We will see. Before that we will see first options. Option A, breakdown, option B, enema, option C, intravenous, option D, failing. The meaning of the word crisis is administration of an enema, intravenous administration of any of a number of solution to provide nutrient, replace loss of blood fluid, control and blood pressure. This also something related to the crisis only, means the intravenous administration of any of the number of solutions to provide nutriment, replace lost body fluid or control blood pressure. Here lysis means breakdown, but crisis means administration of enema. Lysis also sometimes gradual decline of the disease process. Sometimes it is called as fever also. Here in this question we are having about crisis means. We will discuss crisis only. The meaning of crisis is the introduction of large amount of fluid into the body, usually by parenteral injection to replace that lost, and by necessity if another direction toward different place or goal. So here we can provide through the fluid, means fluid enema. This is nothing but here formerly fluid enema, washing out of the material from the any body space. So here in these options, option B is the correct answer. Next we will move on to question number 32. When assessing a client with hyperthyroidism, the nurse should monitor except here the client is having the hyperthyroidism. So the nurse should have to monitor except we will see here options. Option A, rapid irregular heartbeat, increased hunger, nervousness. Option B, weight gain, forgetfulness, calmness. Option C, weight loss, restlessness, dry skin. Option D, weight loss, lethargy, protruding eyeballs. Here what is meant by hyperthyroidism? Hyperthyroidism is also called as overactive thyroid. The overproduction of the hormone by the butterfly shaped gland in the neck is called as thyroid gland. Here hyperthyroidism, when the thyroid gland makes too much of thyroid hormones, the condition is also known as overactive thyroid or hyperthyroidism. Major signs and symptoms of the hyperthyroidism: client losing weight without trying, fast heartbeat, a condition called as tachycardia, irregular heartbeat is called as arrhythmia, pounding of the heart sometimes called as heart palpitation, increased hunger, nervousness, anxiety and irritability, tremors, usually a small trembling in the hands and fingers, sweatings. And also the classic symptoms of hyperthyroidism includes heat tolerance, heat intolerance, tremor, palpitations, anxiety, weight loss, despite a normal or increased appetite, increased frequency of bowel movements and shortness of breath. These all things comes under the clinical symptoms of hyperthyroidism. Till now we discussed related to the hyperthyroidism and signs and symptoms related to the hyperthyroidism. Here the symptoms hyperthyroidism includes rapid heartbeat, weight loss, increased appetite, anxiety, nervousness, hunger, dry skin, lethargy, protruding eyeballs. These all things comes under the hyperthyroidism. Here option B is the except. Here when assessing a client with hyperthyroidism, the nurse must should be monitored except from the options, means here option B is the except here, because the hyperthyroid client will lose the weight without trying, means here weight gain is there, option B. So here option B is the except, no need of discussion related to the other options also. These all related to the signs and symptoms for the hyperthyroidism. Option A, C, D. Here option B is the except here. Next we will move on to question number 33. Blood-stained linen immediately placed in. The blood-stained linen immediately placed in which of the following? We will see here options. First option A, hot water. Option B, boiling. Option C, cold water. Option D, direct sterilization. Here after the blood-stained linen immediately placed in the water loses the ability to wash them out, which is why you should always use cold water when cleaning blood from cloth. Be careful not to use too much water since it can spread the stain. Always use cold water. Any warm or hot water will cook the protein in the blood into fabric. So do not use boiling, direct sterilization, hot water. Blood stained linen immediately placed in the cold water. It is important not to cook the blood stain by using hot water. This could set the stain, making it more difficulty to eradicate. Generally the rinse or soak with cold water will do the trick before the stain sets in. Cold water works great on blood as well as food, beverages and water based paints, while hot water works best on protein based stains. Unfortunately, there is no golden rule to stain removal. For example, most food stains should be soaked in cold water unless it's egg, mustard or tomato based product. When blood gets on clothing or linen, Protein standards try to bind to the fabric. Cold water is superior to hot water for blood stain removal. Here in these options, blood stained linen immediately placed in the cold water. So here option C is the correct answer. Next we will move on to question number 34. Who is the responsible person for the care of the patient? Who is the responsible person for the care of the patient or client? We will see options first. Option A, head nurse. Option B, nursing superintendent. Option C, staff nurse. Option D, director. No doubt here, staff nurse. Staff nurse will be responsible for patient assessment as well as planning of care and subsequent recovery. You should means the nurse should possess a nurturing and kind personality and display excellent communication skills with the role players. A staff nurse is a non-supervisory nurse who provides routine healthcare to patients in the healthcare facility. This means the staff nurse typically report to higher ranking nurses or healthcare professionals such as nurse practitioners, advanced practice registered nurses, directors of nursing or doctors. And also ICU nurse responsibilities also different from the normal nurse means ward nurse. ICU nurse responsibilities includes evaluating a patient's condition and administering treatment as well as providing constant support throughout recovery time. Ultimately, will work directly with patients to ensure they receive attention and medical care needed based on their condition. Staff nurse is the first level professional nurse in the hospital setup. She or he will be skilled nurse giving expert bedside care to the patient. Staff nurses perform duties such as giving patients their medications, monitoring vital signs, documenting patients' condition, and educating patients and health education about the condition. Also, supportive therapeutic treatments also the nurse have to explain to the attenders means caregivers or any family members. So here option C is the correct answer. Next we will move on to question number 35. A newborn develops a cephalohematoma. The nurse should plan to explain to the mother about. Here the newborn develops a cephalohematoma. Then the nurse should plan to explain to the mother about which of the following. We will see here options first. Option A, it is soft sac will bulge in infant period. Option B, it is a normal swelling at suture line. Option C, it will resolve in 3 to 6 weeks. Option D, normal during the vaginal delivery. What is cephalohematoma? Cephalohematoma is a typically harmless condition that causes blood to pool under a newborn's scalp after a difficulty vaginal delivery. But cephalohematomas are very common result of the labor and delivery process and they are rarely serious. Approximately 2 out of every 100 babies develop a cephalohematoma after the birth. Having a newborn with a bruised looking lump on their scalp can be concerning, but cephalohematomas are generally harmless. This lump should get smaller and go away in the few weeks or months without any treatment. So the best treatment is to leave the area alone and give the body time to reabsorb the collected fluid. Usually cephalohematomas do not present any problem to a newborn. Exception is an increased risk of neonatal jaundice in the first days after the birth. Here option C is the correct answer. A newborn develops a cephalohematoma. The nurse should plan to explain to the mother about it will be resolved in 3 to 6 weeks, or here we are having option C, it will be resolved in 3 to 6 weeks, but actually it will be go away in a few weeks or months without any treatment. So here the nurse have to give a health education or explain to the mother about the cephalohematoma. It will be resolved in 3 to 6 weeks. So here in these options, option C is the correct answer. Next we will move on to question number 36. A client receiving diuretics, the nurse should encourage to eat. A client receiving diuretics, nurse should encourage us to eat. We will see first options. Option A, cherries. Option B, broccoli. Option C, apples. Option D, cauliflower. By diuretics, a type of drug that causes the kidneys to make more urine, or diuretics also called as water pills. Diuretics or water pills help the kidneys put extra salt and water into the urine or pee. This is how diuretics clear extra fluid out and bring down your blood pressure. Diuretics also help when the heavy or have too much of fluid collecting because heart failure or other medical problems. The side effects of certain medications such as diuretics or antibiotics. A diet too high in potassium not common, so we have to encourage to take high potassium diet like bananas, apricots, green leafy vegetables, avocados and many other foods, good sources of potassium that the part of the healthy diet. And also we have to encourage many vegetables like high potassium includes spinach, potatoes, broccoli, beets, carrots, and squash. High potassium containing fruits include kiwis, mangoes, oranges, bananas, and red meats, and also the rich in potassium. Getting too little potassium can increases blood pressure. So here we have to encourage the client to take a high potassium diet. So here in these options, option B, broccoli is the high potassium diet. So option B is the correct answer. Next we will move on to question number 37. A child with autism would usually enjoy playing with type of toys from the following. Here the child is having with autism usually enjoy playing with the which type of the toys from the following. We will see here options first. Option A, small blocks. Option B, cuddly toys. Option C, large lead blocks. Option D, sensory toys. What is meant by autism? We will see first. Autism is a spectrum disorder, ASD. Autism spectrum disorder is a developmental disability caused by differences in the brain. People with ASD often have problems with social communication and interaction and restricted or repetitive behaviors or interests. People with ASD means autism may also have different ways of learning, moving or playing and attention. Autism, also called as autism spectrum disease ASD, refers to a broad range of conditions characterized by challenges with social skills and repetitive behaviors. Here a child with autism would usually enjoy playing with type of toys from the following means. Sensory toys help children with autism relax, focus and calm down to a scenario or event. It helps them grasp objects with decreased fear and discomfort, ultimately helping them play naturally. Furthermore, sensory toys help develop social learning skills like negotiation, planning, and sharing. What kind of toys do autistic child like means sensory play like sensory swing, hurl, compressions, click fidget toys, lap pad, weighted sensory turtle. These all things comes under the autistic child toys. Nothing but autism toys also called as sensory toys. Here option D is the correct answer. A sensory toys is a one that is specially designed to stimulate one or more of the senses. Sensory toys may be more appealing to children on the spectrum because they can help the child remain calm and provide sensory experience they want. Here in these options, option D is the correct answer. Sensory toys for movement are extremely popular among kids with autism. So here option D is the correct answer. Next we will move on to question number 38. In PICU, Pediatric Intensive Care Unit, a child with glomerulonephritis Request a snack. That most therapeutic food should be give from the following. Here in pediatric intensive care unit, the child is having glomerulonephritis. Requested a snack. So, what is the therapeutic food should be given to her? We will see first options. Option A, high protein. Option B, low sodium and protein. Option C, high sodium. Option D, low sodium and high protein. See first what is meant by glomerulonephritis. A condition in which the tissues in the kidney became inflamed and have problems filtering waste from the blood. Glomerulonephritis may be caused by infection, inflammatory conditions, for example lupus, certain genetic condition and other disease conditions. Glomerulonephritis is inflammation of the tiny filters in the kidneys. Not only children's, any age they are having any kidney problems means definitely we will restrict the fluids and salt. Means here we are having low sodium in the option B and option D, but here eat a healthy diet with less protein and potassium, phosphorus and salt. The importance of a low protein diet in chronic nephritis. The amount of protein food must be limited since the power of kidneys to eliminate nitrogenous materials is impaired. Amount of such material ingested must be limited to what the kidneys can readily take care of. So here low sodium and low protein diet. Option B is the correct answer. In PICU, the child with glomerulonephritis requested a snack. Most therapeutic food for the child is low sodium diet and protein. So here option B is the correct answer. Next we will move on to question number 40. What are the characteristics of healthy personality? This option, which one is the characteristics of healthy personality? We will see here options. Option A, accurate body image. Option B, negative concepts. Option C, low self-esteem. Option D, clear sense of identity. Option B, negative concepts. This is not a good characteristics of healthy personality. Option C, low self-esteem. Actually, if we are having low self-esteem means there is no characteristics for the good health personality. So here option B and C is the except. We will see option A, accurate body image, and option D, clear sense of identity. A characteristics of healthy personality. Traits of healthy personality ways to feel good about yourself. Then the characteristics of healthy personality is correctly is present. So here being straightforward doesn't mean you are pushy, mean or aggressive. It means being honest and standing up for the everything. When a person is able to concept, appreciate and respect their body, they may be described as having a positive body image. This is not the same as body satisfaction, as you can be dissatisfied with aspects of the body. So here body image is the best characteristics of healthy personality. So here option A, accurate body image is there. When a person has a positive body image and they feel comfortable in their body and have a healthy relationship between how their body looks and feels, this is called as healthy personality. So here the characteristics of healthy personality means here option A, accurate body image is the correct. Body image is the way you think about your body. This includes your thoughts and feelings about it. So here option A is the correct answer. Next we will move on to question number 41. Sorry for the interruption friends, actually we are missing 38th question. So I will explain here about 38th question clearly. Doctor was advised to give a 1000 ml fluid in 6 hours. The drop factor is 15 drops per ml. Yet approximately what is the drop factor for minutes? Here actually doctor has advised 1000 ml fluid we have to administer in 6 hours. The drop factor here 15 drops per ml. Actually there is not mentioned here GTT. In GTT not mentioned. They directly asked about at approximately what is the drop factor per minute. We will see options. First option A 55 drops per minute, option B 27 drops per minute, option C 42 drops per minute, option D 33 drops per minute. In TS MHSRB we are having mock test already, we discussed previously. In the 80th question, in 80 question we are having one question related to the GTT value. Here we are having not GTT value, how much drops we have to administer to the client 1000 ml of fluid in 6 hours. 15 drops per ml they given a drop factor. So here the total volume in ml divided by time in minutes, we have to calculate like this. The total volume in ml divided by in minutes multiplied by the drop factor. Volume to be administered 1000 ml. Time is 6 hours. The drop factor is 15 drops per ml. Just use this formula. Once again I am repeating. Total volume in ml divided by time in minutes multiplied by the drop factor. Volume to be administered 1000 ml, time 6 hours, drop factor 15. So we will get exactly 41.6. So here we are having option C. Directly I am saying answer. Why? Because of we are having less time. Anybody want to know that answer with calculation means you people can do. I already said calculation formula also. So here option C 42 drops is the correct answer. We have to provide 42 drops per minute. Actually we got a answer exactly 41.6. IV drip rate is 41.6 GTT for minute, drops per minute. So here option C is the correct answer. This is 38th question. 38th question was missed in sequence. So we are discussing here in between of 40 and 41. Next we will move on to question number 41. Morbid fear of disease germs is called as. What is the morbid fear of disease germs is called as? We'll see options first. Option A phobia, option B illusion, option C hallucinations, option D delusions. Here the morbid fear of disease about germs is called as medical term mysophobia. Mysophobia. Mesophobia or mysophobia. Mesophobia is an extreme fear of germs. You may go out of your way to avoid situations that expose you to germs. The phobia and steps you take to avoid to worsen over time. Germophobia. The term is used to describe pathological fear of germs, bacteria, uncleanliness, contamination and infections. Germophobia is also called as mesophobia. Morbid fear of disease germs is called as so many names we are having. I will give a clear clarification here. Germophobia is also called as morbid fear of germs. Means here we are having germophobia also known as mesophobia, verminophobia and bacillophobia. So here morbid fear of disease germs is called as phobia. So here in options, option A is the correct answer. Commonly associated with OCD, obsessive compulsive disorder, but can present a widely variety of people. Mesophobia also known as verminophobia, germophobia, bacillophobia and bacteriophobia. So here we are having so many phobia. Just watch the mental health nursing related to the MCQs. We already discussed related to the phobias also, and also read proper about phobias. We will get one question from the phobias. So here in these options, option A is the correct answer. Next we will move on to question number 42. The part of the uterus which is situated between the body and cervix is known as. Part of the uterus which is situated between the body and cervix is known as. We will see here options. Option A ovary, option B isthmus, option C tubes, option D vagina. The part of the uterus between the corpus and cervix, it where the uterus starts to narrow or thin, is called as isthmus. The location of the cervix of the uterus in the relationship between the peritoneum. The rear supravaginal cervix is covered with the peritoneum, which runs into the back of the vaginal wall and turns upwards and onto the rectum, forming the recto-uterine pouch. The cervix is the most tightly connected to the surrounding structures of the uterus. Cervix is the lower narrow end of the uterus that connects the uterus to the vagina. It made up of the internal os. The uterus subdivides into the three segments, namely body, cervix and fundus. Here, the part of the uterus which is situated between the body and cervix is known as isthmus. Here in these options, option B is the correct answer. Next, we will move on to question number 43. Which of the following gas is commonly used in the laparoscopy? Here, from the following gases commonly used in laparoscopy, which gas we can use? We will see here options. First, option A water, option B N2O, option C air, option D CO2. Laparoscopic surgery is now widely performed to treat various abdominal diseases. Currently, carbon dioxide means CO2 is the most frequently used gas for the insufflation of the abdominal cavity, means pneumoperitoneum. Large incisions can be avoided during the laparoscopy because the surgeon uses instruments called as laparoscope. This is a small tube that has a light source and camera which relays images of the inside of the abdomen or pelvis to the television monitor. The gas most commonly used for the creation of pneumoperitoneum is carbon dioxide. The carbon dioxide included pneumoperitoneum exerts its physiological effects via two different mechanisms. Mechanical effects relating to the increased intraperitoneal pressure. So, laparoscopic surgeries involves insufflation of a gas is usually carbon dioxide into the peritoneal cavity, producing the pneumoperitoneum. So here in these options, which of the following gas commonly used in the laparoscopy? Means here option D is the correct answer. Carbon dioxide is the most commonly used gas for the abdominal insufflation in the laparoscopic. So here option D is the correct answer. Next we will move on to question number 44. Bartholin's ducts opens into. We will see here options. Option A labia majora and minora. Option B vagina and vaginal wall. Option C lateral surface of the vulva. Option D inferior surface of the vulva. What is meant by Bartholin ducts? The Bartholin ducts open into the vaginal opening. Bartholin's glands are found in the external peritoneal pocket in the females, whereas bulbourethral glands are situated in the deeply situated perineal pocket in the males. Their ducts open into the navicular fossa and range in the length from the 1.5 to 2. The Bartholin's glands are located on each side of the vaginal opening. These glands secrete fluid that helps lubricate the vagina. Sometimes the openings of these glands become obstructed, causing fluid to back up into the glands. The result is severity and relatively painless swelling called as Bartholin cyst. Bartholin ducts or Bartholin glands. Bartholin glands are located on the inferior and lateral surface of the vulva. It will be opens into the vagina and produce thin mucus that helps lubricate the vagina. So here Bartholin ducts are opens into the vagina. Bartholin ducts may be also known as major sublingual ducts, the largest excretory duct of the sublingual gland in the mouth. Here we are having option B vagina. So the Bartholin ducts are opens into the vagina and vaginal wall. So here in these options, option B is the correct answer. Next we will move on to question number 45. Which is not a assisted reproduction technique. Here in these options, which one is not assisted reproduction technique? We will see first options. Option A, ZIFT. Option B, GIFT. Option C, IVF and ET. Option D, artificial insemination. Here, procedures where only sperm are manipulated, such as intrauterine insemination, are not considered under this definition. Additionally, procedures in which ovarian stimulation is performed without a plan for egg retrieval are also excluded from this definition. So here, which is not assisted reproduction techniques means here option D is the correct answer. Artificial insemination or intrauterine insemination. The reproduction techniques like methods includes GIFT means IVF and ET. We will see clearly. Option A, ZIFT, zygote intrafallopian transfer. ZIFT means zygote intrafallopian transfer. Option B, GIFT means gamete intrafallopian transfer. Option C, IVF means we know in vitro fertilization. And ET means embryo transfer. Clearly, once again I am explaining. ZIFT means zygote intrafallopian transfer. Option B, GIFT means gameto intrafallopian transfer. Option C, IVF means in vitro fertilization and ET means embryo transfer. The reproduction techniques, these option A, B, C, three are the reproductive techniques. So used to aid in achieving pregnancy conception in individual who are having difficulty doing a so spontaneously. So here in these options, option D is the except here. Next we will move on to question number 46. DIC often results in complication initially associated with. DIC means here disseminated intravascular coagulation. Disseminated intravascular coagulation often the results in complication initially associated with. We will see here options. Option A, brain. Option B, kidney. Option C, lung. Option D, stomach. What is meant by DIC? We will see now. DIC means disseminated intravascular coagulation. It is a serious disorder in which the proteins that control blood clotting become overactive. Causes like blood transfusion reactions, cancer, especially certain types of leukemia, inflammation of the pancreas, pregnancy complications, and recent surgeries are anesthesia. Liver disorders. Here, DIC often results in the complication initially associated with. Option D, stomach is the correct answer. Because of DIC is severe complications of gastric adenocarcinoma. So, DIC is a complication of inflammation from an infection or injury or illness. So, here the severe complication of gastric adenocarcinoma is the results of the DIC. So, here in these options, option D is the correct answer. DIC, disseminated intravascular coagulation, often results in complication initially associated with stomach or gastric adenocarcinoma. Next we will move on to question number 47. Which of the following symptom is associated with ulcerative colitis? Here from the symptoms, which symptom is associated with ulcerative colitis? We will see first options. Option A, fistulas. Option B, dumping syndrome. Option C, rectal bleeding. Option D, soft stools. What is meant by ulcerative colitis? Briefly we will see. Ulcerative colitis is a chronic disease in which abnormal reactions of the immune system cause inflammation and ulcers on the inner lining of the large intestine. Option B, dumping syndrome is the correct answer. Dumping syndrome is also called as rapid gastric emptying. Is a condition that causes food to move from stomach to the small intestine before the stomach has to time adequately digest, especially high sugar foods. Dumping syndrome is mainly characterized by abdominal pain, nausea or vomiting, weight loss, diarrhea, early satiety, flushing, and fatigue. These symptoms are manifestations of the variety of gastrointestinal and endocrine conditions, so careful evaluation is wanted. Here, the dumping syndrome is a group of symptoms such as diarrhea, nausea, feeling light-headed, or tiredness after a meal. Which of the following symptom is associated with the ulcerative colitis? Means here option B, dumping syndrome is the correct answer. Dumping syndrome. What is meant by dumping syndrome? Means dumping syndrome is a group of symptoms such as diarrhea, nausea, feeling light-headed, or tiredness after the meals. So here option B is the correct answer. Next we will move on to question number 48. The major cause of brain dysfunction in hepatic encephalopathy. What is the major cause of brain dysfunction in the hepatic encephalopathy? We will see options. First option A, cirrhosis of liver with portal hypertension. Option B, dehydration and infections. Option C, hypoxia, trauma, chronic liver failure. Option D, some medications and surgical interventions. What it mean by hepatic encephalopathy? We will see hepatic encephalopathy is reversible syndrome of impaired brain function occurring in patients with advanced liver diseases. Hepatic means liver, so here group of irreversible syndrome or irreversible disorders, impaired brain function occurring patients with advanced liver diseases. Hepatic encephalopathy is an often temporary neurological, means nervous system disorder due to chronic or severe liver disease. Loss of brain function occurs when the liver is unable to remove toxins from the blood, is called as hepatic encephalopathy, HE. Main causes for the hepatic encephalopathy are alcohol use, certain drugs affect nervous system such as sleeping pills and antidepressants, infection, liver shunt, dehydration or electrolyte imbalance, constipation, kidney diseases, digestive tract bleeding. These all are the common causes for the hepatic encephalopathy. Hypoxia and low oxygen levels. So here we are having the option C, hypoxia, trauma, chronic liver failure. We are having the hepatic encephalopathy due to the chronic liver failure, and also low oxygen levels or hypoxia is also one of the cause for the encephalopathy, hepatic encephalopathy. So here the major cause of the brain dysfunction in the hepatic encephalopathy is hypoxia, trauma, chronic liver failure. So here in these options, option C is the correct answer. Next we will move on to question number 49. The most objective and reliable source of nursing knowledge is through. Here the most objective and reliable source of the nursing knowledge is through the, we will see options. Option A, authority. Option B, tradition. Option C, trials. Option D, scientific research. Most objective and reliable source of nursing knowledge. The knowledge needed for practice should be specific and outcomes focused, is called as scientific research. The source of nursing knowledge. Nurses often use knowledge from the biological sciences such as physiology as well as knowledge from the social sciences such as psychology. The best source of reliable writing in nursing means most reliable publication of information in nursing is peer-reviewed scientific journals. Most important objectives and reliable source of the nursing knowledge is provide effective nursing care for maintaining best possible level of health in all aspects, promote self-care in people under their care, apply problem-solving techniques in nursing practice, apply knowledge from the humanities, biological and behavioral science in functioning as nurse. The most objective and reliable source of nursing knowledge is through the scientific research. Here in these options, option D, scientific research is the correct answer. What is meant by scientific research? Scientific research is conducted for the purpose of contributing towards science by the systemic collection, interpretation, and evaluation of the data, and the two in a planned manner is called as scientific research. So here in these options, option D is the correct answer. Next we will move on to question number 50. This is last question in this part 2. Today's class 50th question is last question. Shirotkar technique is used for the. Shirotkar technique is used for the. We will see here options first. Option A suturing, option B cervical incompetence, option C rigid cervix, option D cervical laceration. What is meant by Shirotkar technique? Shirotkar technique is a suture, high vaginal or cervical suture. It is a suture or stitch which is placed around the cervix, neck of the womb and tied into order to prevent the cervix opening to early pregnancy. Shirotkar technique involves the transverse anterior colpotomy, dissection of the bladder up to the internal cervical os, and posterior colpotomy with dissection of areola and peritoneum upwards to the internal os. The Shirotkar technique involves transverse anterior colpotomy, dissection of the bladder up to the internal cervical os. The cervix excited using transverse incision in the vaginal mucosa at the anterior aspects of the cervix. Question also priority question, but here option B also related to the Shirotkar technique, option C also, but here priority, according to priority, suturing is the first priority for this question. Shirotkar technique is used for the suturing or stitch which is placed around the cervix and tied in order to prevent the cervix opening too early in pregnancy. So here in these options, option A is the correct answer. I was not mentioned here. Option A is the correct answer. Next upcoming classes we will discuss from the 51 question to further questions in part 3. This is part 2 related to the model paper of set 5, part 2 related to the staff nurse 2023. Thank you so much for watching, and please give a like and share your opinion in comment section. Anybody here new to this channel, please subscribe my channel, click on the bell icon for further notification, and please give a like and share the video to your friends. Share your opinion in comment section. Stay tuned, keep watching friends.